I'm Edd Berry. I'm Director of Finance Innovation at Manchester University NHS Foundation Trust. I work around all the technology that we brought into the organisation within finance, so particularly automation and planning, and trying to look at how we can bring that technology in to make a big difference to what staff are doing in their day jobs and getting rid of all the transactional work and trying to make their work-life balance a bit better. Yeah, Manchester University NHS Foundation Trust it's quite a long title. We're known as MFT colloquially. It's one of the largest NHS acute hospital trusts in the country with a turnover of about 2.5 billion and about 30,000 staff. So we're a large organisation. We consist of about 10 hospitals. We began our journey by starting with a proof of concept model that we built with Automation Anywhere to look at our invoice processing, where we process around 275,000 invoices a year. So really transactional, big team involved. And we thought if we could bring in automation for that, there'd be a real benefit for the organisation. We're now up to 10,000 invoices a month that are processed end to end without hardly any human interaction at all. So that's a huge step forward. And that's going towards half the invoices that we have. But I think more importantly, it's proven that the automation technology will work within our organisation. And we've done lots of other automations within finance, but what's been really exciting is other colleagues in workforce and back office functions are looking at it. But probably the best bit so far is that clinical services have begun to look at the power of automation. And during COVID, we were able to really quickly deploy some automation solutions that had a real impact on improving some of our service delivery for patients. What's really exciting is when we began, we didn't really know anything about automation. And now we've got a much better idea. It's kind of changing how our function and other functions will work in the future. I think it's really interesting that 60% of the work that we do today didn't exist in the 1940s. So there'll be jobs that kind of come through this. And when you look at the impact and the potential this technology's got, we can completely change how we do the back office function. And if we can do that in a more efficient and agile way, making people's work-life balance better, that helps also redirect resources into frontline services and enables our staff to kind of use their brains rather than doing transactional work and really help clinicians and managers to give a better service to patients and make the NHS as efficient as it can be.